I'd like to welcome everyone here. Good afternoon. Welcome to the Lung Health Foundation's Queen's Park Advocacy Day. My name is Carly Weeks. I'm a national health reporter with the Globe and Mail, and I'm going to be the moderator for the event today. Before we begin, I just want to acknowledge that the land on which I gather is the traditional territory of the Anishinaabe, the Mississaugas of the Credit First Nation, of the New Credit First Nation, the Haudenosaunee, and the Huron-Wendat. This land is now home to many Indigenous nations from across Turtle Island, including Inuit and the Métis. It's really hard to have any conversation about lung health in Canada without connecting how those issues affect many Indigenous communities and the harms that were done to them by settlers. To this day, Indigenous people in Canada face many health disparities and poor lung health outcomes as a result of these chronic conditions and many years of colonial rule and their legacy. I recognize that many of the people who are joining us today in this new land of Zoom are going to be in places in parts of Canada that don't apply to this particular land acknowledgement. So I would welcome everyone to take a little bit of time after the meeting today to learn about some of the colonial and treaty history of the land that you live and work on, and reflect on the roles that we can play to ensure that these disparities in health can be eliminated in the future. And so just thanks to all of you who are here taking part in this important discussion and about some of the major issues facing lung health in Canada. The Lung Health Foundation has been doing a lot of work on these issues, and we're going to hear directly from speakers on the challenges facing lung health and the steps that should be taken to advance the respiratory health of Canadians. I'm first going to begin this afternoon by welcoming Peter Glazier, the Executive Vice President of Lung Health Foundation, to say a few words. Welcome, Peter.
Thanks so much, Carly, and good afternoon, everyone. While we're obviously disappointed that we can't come together in person again this year, we are thankful to all of you for joining us today virtually. It's a complete understatement and a bit of a cliche to say that the past year has been a challenge for us on so many fronts as we live through the third and fourth waves of the pandemic. But for those impacted by lung disease, the challenges were even more profound. Across the country and here in Ontario, we saw gaps in care and treatment deepen significantly as patients struggled to get the care they needed. Reduced physical activity, isolation, and the interruption of many clinical services all combined to impact the physical and mental health of those living with lung diseases such as asthma, COPD, and lung cancer. It's a challenge that the Lung Health Foundation has responded to by adapting its approach, embracing innovation and collaboration to better meet the needs of the people we exist to serve. This past year, for example, we partnered with CloudDX and Oak Valley Health on a COPD remote home monitoring program, a program working to fill an unmet and urgent gap by helping patients better manage their symptoms and keep them out of hospital. We also launched a lung cancer support group program for patients and caregivers, providing tailored psychosocial support. And we also offered a free monthly phone-based support group program for people living with other lung diseases. Just some of the ways we're working to extend the healthcare journey directly into services that aren't conventionally thought of as part of the healthcare system, but that are core to improved outcomes and patient well-being. On the health promotion front, we continue to play a strong role in the prevention of infectious respiratory disease. To that end, we launched a new partnership with McMaster University's Global Nexus for Pandemics and Biological Threats, a partnership that has allowed us to advance policy recommendations and to provide Canadians with evidence-based, timely information on COVID-19 vaccine efficacy and other public health measures put in place to manage risk and protect people's health. To bring all of this alive, you'll be hearing directly from two patient advocates on their experience with lung disease and the policy recommendations for improving timely access to quality care. And you'll also hear from a leading Ottawa-based researcher on the factors that continue to affect vaccine acceptance in the province and across Canada. I'm also pleased that our political leaders are joining us today: Minister of Health, Christine Elliott, NDP Health Critic, MPP Gélinas, Liberal Critic for Health and Long-Term Care, MPP John Fraser, and Leader of the Green Party of Ontario, MPP Mike Schreiner. Thank you all for joining us today. We hope that the information and insight provided to you this afternoon will pave the way for real change in the area of lung health and towards a Canada where everyone can breathe easier. Thank you, and on that, I'll pass it back to Carly.
Thank you so much, Peter. Very, very inspiring words about some of the things we're going to hear about today. Before we go any further, I would love to give the floor to the Deputy Premier and Minister of Health, Christine Elliott, to say a few words. Minister Elliott, thank you for being here.
Well, thank you very much, and good afternoon, everyone. To start, I would like to thank the Lung Health Foundation for your leadership and dedication to improving the lung health of Ontarians. I would also like to thank you for your ongoing efforts to support patients and encourage patient-focused healthcare, especially throughout the COVID-19 pandemic. Your efforts to bring care to patients at home and beyond traditional pathways has helped to improve access to care for patients living with chronic obstructive pulmonary disease, asthma, and lung cancer. Throughout the COVID-19 pandemic, we have faced unprecedented challenges, but our healthcare partners, providers, and frontline healthcare workers continue to adapt, innovate, and develop creative solutions to ensure patients get the support that they need. Ensuring patients get appropriate care at the right time and in the right place is a pillar of our government's comprehensive plan to build a better, connected, patient-centered healthcare system. As we continue this work, we will also continue to engage patients, families, and caregivers. During my time as Ontario's first patient ombudsman, and over the last few years as the Minister of Health, I've heard from many patients and families about different concerns, complaints, and experiences. And this has reinforced my own longstanding views that patients should be fully engaged and involved in the healthcare that they receive. So I welcome this opportunity to be a part of your Patient Advocacy Day, and I look forward to listening and learning more about patients' experiences. Our government is proud to call the Lung Health Foundation a partner in our healthcare system, and together we will build a better, connected healthcare system for all Ontarians, including those living with lung disease. So thank you very much again, and I wish you all the best with your advocacy for today. Thank you.
And thank you very much, Minister Elliott, for those words and for being here today. I'm very pleased next to introduce NDP Health Critic MPP Fraser Gélinas. Thank you so much for being here, and the floor is yours to say a few words. I think you might be on mute.
Of course, I have to do that.
2021 problems.
Exactly. Good afternoon, everyone. Bonjour tout le monde. Ani. As it was mentioned, my name is Fraser Gélinas. I'm the MPP for Nickelbelt, which is one of those big northern riding, and also the health critic for my party, the NDP. I have been the critic for the last 14 years, which means that I've had many, many occasions to work with what used to be Ontario Lung Association, now Lung Health Foundation. I'm always happy to share that it was following we had a Queen's Park Lung Caucus at Queen's Park, where MPPs from different parties, we would sit together and the Ontario Lung Associations would come and brief us. Following one of those briefings, myself and Dave Levac, who was in a Liberal MPP, got together to put forward the first co-sponsored bill in Ontario that was to ban flavored cigarillo. At the time, the tobacco industry was trying to recruit more youth to pick up smoking, and they were doing this through flavoring cigarillo with flavor that really attracted kids. So I'm proud to say that this bill actually went through and became law. We had a few hiccups along the way, but we got it done. More recently, I was able to table and debate a bill on vaping is not for kids. All of this is feasible because your foundation takes the time to come and brief us, MPP, to do the hard work of collecting the evidence that supports the decisions to move forward with different pieces of legislations and policy. And I thank you for all of your hard work during all of those years. We all know that 1 in 5 Ontarian, 1 in 5 Canadian will have some lung problems. So the work that you do in health promotion, to keep people healthy, in disease prevention so that the disease doesn't progress, or treatment, are all very important and very much needed here in Ontario, and I'm guessing everywhere else. Has the pandemic been hard? It has been hard on everyone. It has been especially hard on people facing lung disease. The opening remarks made that clear, that many people, whether you have asthma or lung cancer or COPD, were very much at risk before the vaccines became available, and even now of catching COVID and becoming really sick. Not an easy time. Again, the foundation rise up to the challenge to really try to break the isolations, to bring forward valid information, and to make that information available to all of us. Thank you for all you do. There are still many barriers to the people I serve for them to gain full access to the care they need and deserve to deal with their lung problem and lung disease. And I hope to be able to help you move this forward because, as you say so well, everyone deserves to breathe easier. Thank you. Merci. And Jimmy Witch.
Thank you so much for that, for those inspiring words. And next, I'm going to turn it over to our next speaker, MPP Mike Schreiner. So please, MPP John Fraser, I was getting ahead of myself, the Liberal critic for health and long-term care. Mr. Fraser, thank you for being here, and the floor is yours to say a few words.
Thank you very much, Carly. And thank you very much to the Lung Association to inviting me to say a few words. And I want to echo my colleagues' comments. Just thank you for all your advocacy, not just on the issues and collecting the data, but bringing stories to Queen's Park, which you have for a while. Stories change things. And, I spoke to Debbie this morning. Her story is important because it's real. It's what is happening inside people's lives. And I think it's really important. And I want to thank Debbie for our conversation this morning. But for all the work that's done as well by the Lung Health Foundation to help people in communities, not just come here to Queen's Park. I will say one thing that I was very pleased to hear this morning is that the lung cancer screening program is now permanent. Give the government full credit for that. There's a lot more work to be done to make sure that we best put socialize it. Make sure it's something that people know about, that physicians know about. It was really very encouraging. And that's a result of the work that you've done. And I'll leave my remarks at that. And again, thank you very much for inviting me to participate.
Thank you very much for those words. And yeah, we're going to hear some more about lung screening in just a little bit. Before we go further, I will now be happy to introduce MPP Mike Schreiner, the leader of the Green Party of Ontario. Thank you so much for being here, and the floor is yours to have a few words.
Thanks, Carly, and thanks for inviting me to be a part, join you today. And when you skipped over John, I was going to knock on the wall right next door here because I was hoping I was going to say, John, you got to join us because we share a wall together. But anyway, I just want to say just how much I deeply appreciate the Lung Health Foundation's work to promote health, lung health especially, but also access to care and people-centered care. And I really want to just support and do everything I can to support your calls for continued funding for respiratory care programs. Certainly applaud the announcement of permanent lung cancer screenings. Absolutely support just the vital work you do in trying to prevent youth from smoking and vaping. And of course, I've been, really thankful of the proactive work you've been doing around promoting vaccination and greater access to vaccines. And, COVID has really highlighted the importance of lung health and the vulnerabilities that people with asthma, COPD, and lung cancer face. And I just want to close by saying that, I read last week's Auditor General's report. And I was really struck by the fact that air pollution causes 600 annual cancer cases every year and 6,600 annual premature deaths resulting from local sources of air pollution. And just to say how much, I want to work across party lines and work with you to ensure that we have clean air for people to breathe. I was struck this summer when 6 First Nations tragically were forced to evacuate due to the forest fires. But all across Ontario, everyone was affected by the poor air quality. I think Toronto at one point had first or second worst air quality of any city in the world for a couple of days. And the disproportionate effect that has for people with asthma, COPD, and lung cancer, and just to do everything we can to ensure that people have healthy lungs and healthy air to breathe. So thank you for the great work you do, and always happy to meet and work with you.
Thank you so much for that. And yeah, it just reminds me also of, the fact that we've been in this pandemic situation for close to 2 years now. And of course, people who have lung disease are obviously at much higher risk as a result. So, there's so many things we think about with all of the things going on in our daily lives, whether it's climate change, air quality, COVID-19, our lung health is affected by all of them. Before I turn it over to our next speaker, we're going to play a short video that spotlights some of the Lung Health Foundation advocates. So some of these passionate advocates, it's really great to have them lend their voices to this important cause, and they really help put a face to some of the policy changes that are being worked toward by the Lung Health Foundation. So here are a few of them.
Started vaping as a social interaction with people. It was everybody had one. It was very readily available. Got to university, I started to realize that this is going to have a bigger impact on me throughout my entire life, and I decided to start speaking up against it because nobody else will, and it's just not good to see the state that people my age are in my opinion.
I wanted to really share my story, and if I can make the next person that gets diagnosed after me, make their journey a little easier, I think that it's been worth it. I think it's important to share my story, to tell people that just because you don't smoke doesn't mean you're not going to get this disease. It's really doesn't discriminate. So I think that message needs to get out more.
I decided to become an advocate because I feel that people who have COPD just sit back and let it take over. And I don't think that that's the way to go.
Wanted to use the experience for good and connect with other people who had gone through something similar. And I came across the Lung Health Foundation and I felt like it was kind of perfect. I thought their values were really in line with mine. I thought they were doing really great things.
They've been so supportive. They've given me a sense of purpose. That's why I became an ambassador.
One of my lung cancer sisters had introduced me to Lung Health Foundation. And so they have been a group that is very active and very on top of advocacy and education for lung cancer patients.
I'm now going to introduce Marilyn Sorochan. She has both asthma as well as COPD, and she is a patient advocate who has participated in many of the Lung Health Foundation's support programs. Marilyn, thank you so much for being here, and please take it away and say a few words.
Thank you so much. I am pleased to participate in today's advocacy program with the Lung Health Foundation. I will briefly share my story and my thoughts about what supports are important for people who live with COPD. My journey with lung disease began when I was diagnosed with asthma when I was 7. My family were not surprised, as asthma ran in our family. Effective treatments, however, were limited in the 1950s, and I missed many weeks of school each year. Old photos show a skinny little girl with hunched up shoulders and dark circles under her eyes. In later years, I have come to realize how much environmental exposures like cigarette smoke, farm animals, wood smoke were contributing to my symptoms. And indeed, I have been managing my asthma and now COPD ever since. I've learned to identify allergens and situations which cause flare-ups, modify my environment, incorporate exercise in my activities, and I have benefited from new medications and therapies over the years. I typically had 2 or 3 exacerbations each year, some of which required hospital stays. However, in spite of that, I led a busy family life, raising 3 children, and I retired from a rewarding 39-year career in education in 2002. I think that there are 2 factors which are important for anyone living with chronic illness. The first is appropriate medications, and the second is knowledge. I have been fortunate to have attended 3 respiratory rehabilitation programs over the years, from which I learned the knowledge and skills to more effectively manage my disease. The first was an 18-session outpatient program offered here at South Lake Health Center in Newmarket. I did that in 2010, and it had both an educational and an exercise program. I benefited so much from it, but unfortunately, the following year that program was cut because of tight budgets. By 2017, I was dealing with severe COPD, the impairment of my lungs increasing, and the quality of my life becoming more and more compromised. At that time, I was referred to a 6 weeks inpatient respiratory rehabilitation program at West Park Health Center in Toronto. I learned so much about managing symptoms, using medications more effectively, finding less taxing ways to do daily activities. And with the intense coaching, I really got a program of exercise in place. Their motto at West Park is "Get your life back." And for me, that was not an overstatement. In the winter of 2018, I had a particularly serious bout of pneumonia, requiring a 10-day hospital stay and leaving me dependent on oxygen therapy and feeling very, very frail. That summer, I went back to West Park for a 7-week inpatient program. I got back on track, regained my strength, and was able to function without the oxygen. Today, I'm doing really well, managing symptoms and committed to my exercise program. I just finished a 16-session virtual Fitness for Breath program of exercise that was sponsored by Lung Health Foundation. Another source of information and social networking available in my community has been our local COPD support group, which is supported and sponsored by the Lung Health Foundation. I have chaired it for a number of years, and our aims are social and educational. A number of our members have called the Lung Health Foundation helpline when they were experiencing difficulties and concern. I want to close by emphasizing the value of locally available respiratory rehabilitation programs for those living with COPD. When we know better, we do better. Education and good self-management strategies empower patients to maintain an optimal level of function and avoid hospitalizations. And finally, for many of us, the Lung Health Foundation and their resources are an important support in living well with COPD. Thank you.
Thank you so much, Marilyn, for sharing your story with us, and how having some supports in place can also really help patients. COPD is a very common illness, and it's actually the leading cause of hospitalization in Canada. But it often goes overlooked, and I think that it's one of those diseases that we don't hear enough about. In fact, because of just the sheer number of people who are affected, and the cost to the healthcare system, and the cost of patients' quality of life. I think a lot of people would be surprised to know that it is, in fact, the leading cause of hospitalization. And the highest number of readmissions are linked to people who are readmitted to the hospital because of conditions related to COPD. And 1 in 5 COPD patients are readmitted to acute inpatient care within 30 days. This is a huge burden on patients, on caregivers, and on the healthcare system. And it's clear that more can be done to help improve the quality of life for these patients. Evidence shows that providing some of the support that Marilyn spoke about, some things like, exercise therapy, pulmonary rehabilitation, access to professionals like respiratory educators, these things are really key to helping patients maintain their quality of life, stops or slow disease progression, reduce the chance of hospitalization and death, and of course, at the end of the day, reduce some of the very expensive costs on the healthcare system by keeping people well and keeping them at home. Before we go to our next speaker, I'm going to introduce you to a campaign that the Lung Health Foundation launched in partnership with Lung Cancer Canada. And this is one called Stop Asking the Wrong Question. So this was really a campaign that was born out of the need to address the stigma that's faced by many people who have been diagnosed with lung cancer. Regardless of whether or not people have been smoking in their life, people who have lung cancer are often stigmatized and sort of blamed for their illness, which is a terrible thing for anyone to deal with, especially if they're facing something as serious as lung cancer. No one deserves to get sick. No one deserves to get cancer, whether or not they've been smokers or at all. It's wrong and it's unfair, and everyone deserves the same compassion and care, especially when they're undergoing such a hard journey. Lung cancer is the largest cancer killer in Canada, but it remains the least funded. And a large part of that, many experts agree, is because of the stigma that's often placed on lung cancer. There are more people expected to die from lung cancer than colorectal, breast, and pancreatic cancer combined. And the survival rate for lung cancer has barely moved in recent decades. Less than 1 in 5 people will be living 5 years after diagnosis. So stigma has delayed progress, it's delayed funding, and there's a growing push to change that with the Lung Health Foundation leading a role. And we're going to play this video now that can help talk about some of those issues and what needs to be done.
The first time I told somebody outside of my wife, the first question they asked was, well, you weren't a smoker, were you?
The first thing they would ask is, have you ever smoked? Were you around a lot of secondhand smoke? Not many people first ask, how are you doing? Or how are you feeling? Is everything okay?
I can sadly say that when you get a lung cancer diagnosis, no one comes to your door with a casserole wishing you well.
The Lung Health Foundation and Lung Cancer Canada have also released the second edition of the policy report, Start Asking the Right Questions About Lung Cancer, a roadmap for lasting change. And this can be found at thewrongquestion.ca. The report offers some innovative solutions to some of the top challenges that stand in the way of lung cancer progress. And what's exciting is that there are some things that can be done and some things that we know can help improve outcomes for people who will be diagnosed with lung cancer. So please check that out. I'd now like to introduce lung cancer patient and advocate Andrea Redway to say a few words. Andrea.
Thank you, Carly, for inviting me to say a few words about the Wrong Question campaign. My first introduction to lung cancer was about 20 years ago when my husband's uncle was diagnosed with lung cancer, and he died 2 weeks later. It was absolutely shocking how late he had been diagnosed and how quickly he was gone. Then in 2009, my mother-in-law was diagnosed with stage 3 lung cancer. For how reluctant she was to speak to her own sisters and even her closest friends when she was diagnosed. I didn't recognize it as clearly as I should have then, but I understand now that it was her shame and self-blame that made her withdraw at a time when she needed their love and support the most. And then to my complete shock, 6 years later in 2015, I was completely blindsided with a stage 4 lung cancer diagnosis at the age of 47. The only sign was a cough that started about 5 months earlier. But then other symptoms appeared, which led me to see my doctor. And within a few weeks, I was diagnosed. The cancer had already spread to my brain, my bones, adrenal gland, and there were early signs on my colon. It was devastating. And as I knew, my prognosis was grim, and my kids were only 8 and 11 years old at the time. I was extremely lucky to get access to a new innovative treatment that had just been approved in the US for advanced lung cancer, immunotherapy. After 8 months, the cancer had disappeared outside of my lungs and my primary tumor had shrunk by about half. It was a miraculous result for me and my family, especially given that the 1-year survival rate for stage 4 lung cancer is less than 5%. Going back to those days when I had just received my diagnosis, I remember being asked if I smoked over and over again in the blur of medical appointments I had to go through. And when we were sharing the news about my diagnosis. For me, the answer was no, but why should that matter? And why didn't the rack of there were pamphlets on many other types of cancer, but when it came to lung cancer, the only information was on support for quitting smoking. It's only since my own diagnosis that the stigma of smoking and its impact has really come into focus for me. The way my mother-in-law felt about her diagnosis is far too common. Many smokers and even former smokers feel a personal shame about having lung cancer and don't want to talk to their families about it. And like my husband's uncle, when they start having some symptoms, they delay going to their doctors, not just because of fear of being told they have lung cancer, but because of the shame of feeling that they brought it upon themselves and are less deserving of care. Less deserving? Research done by the Global Coalition on Lung Cancer has shown the smoking stigma leads to less empathy for lung cancer patients and ultimately less funding for research and fewer new treatments. Lung cancer is the most commonly diagnosed cancer and the biggest killer of all cancers, as has already been said. But survival statistics are extremely poor and have changed very little for decades. We have to change the story about lung cancer and start asking the right questions, such as why isn't lung cancer screening widely available for those at high risk when it has been proven to lead to earlier diagnosis and save lives? How can we diagnose patients faster and get access to more effective treatments? We know that molecular testing and a more personalized approach to treatment can make a difference. How do we ensure that everyone has access to this testing? We need faster approvals of new drugs and equitable funding for innovative treatments. I've personally, because they ran out of options. With more treatments and better access to new drugs, all of them would still be alive today. If we start asking the right questions, we will start getting the right answers. Please join us in asking the right questions, questions that will give lung cancer patients and their families a fair chance. Thank you.
Andrea, thank you so much for that and for sharing this, your story and experience. You know, it is very touching, and we wish you the best of health. And thank you for your advocacy as well, and bringing to light some of these really important things that need to be done. What's really exciting is that earlier this year, the Ontario government announced that the lung cancer screening pilot for people at high risk of lung cancer will be made permanent. So this is going to really help get some patients diagnosed early, which can make all of the difference in their long-term health. Screening, however, is only available at 4 sites in Ontario. And so that means that certain people who are at risk, certain vulnerable groups and individuals, and those who may be marginalized and even at higher risk do not have access to this screening as of yet. And that's something that needs to be addressed. And, you know, as we know, healthcare should not be determined by postal code. The Lung Health Foundation, along with Lung Cancer Canada and the Canadian Cancer Survivors Network, have been advocating for the lung cancer screening pilot program to be expanded to include more sites so that access and health equity is included as a key success factor moving forward. I'm now going to introduce Dr. Justin Presso. He was an associate professor in the School of Epidemiology and Public Health at the University of Ottawa, as well as a scientist at the Ottawa Hospital Research Institute. He leads the Psychology and Health Research Group, and he focuses on understanding the factors that can help and hinder behavior changes in healthcare in patients and in the general public. So thank you so much for being here. The floor is yours.
Thanks so much, Carly, and thank you all. Really delighted to have the opportunity to speak with you this afternoon. I'm going to talk a bit about some of the work that we've been doing around COVID-19 vaccine confidence and hesitancy. Next slide, please. So the first thing to say is, by all indications, COVID-19 vaccination continues to be safe and very effective, whether we're looking at cases on the left, hospitalizations in the middle, or ICU admissions on the right in Ontario. Being fully vaccinated in the blue line is clearly much more protective than being unvaccinated in the orange line. So vaccines clearly work. Next slide. And in Ontario, our rates of vaccination are actually quite good, but they are not the same at the same rate for everyone. And we can look at the data in different ways. One of which is by age group. So on the left, you can see that there's clearly an age gradient. As you go down the decades of life, you have less percentage of people that have been fully vaccinated with 2 doses, although it's worth noting the 12 to 17-year-olds are giving the slightly older age group a run for their money, which is great to see. We can also look at the data from an equity perspective, which is an important one. If we take, for example, the graph on the right indicates Indigenous adults with a 2nd dose in Toronto in the blue line, clearly getting vaccinated at a lower rate relative to the general Torontonian and Ontarian population in orange and green, respectively. So clearly we're doing well, but we can do better. Next slide. So one of the ways to address that then is to understand and address vaccine hesitancy and promote confidence in the COVID-19 vaccination. So the question, I guess, or that we had is, well, what do we know from studies on this? So since the vaccines have been approved, my team has been conducting monthly reviews of the research literature. And up until August, we've identified 175 studies that have specifically looked at what is driving COVID-19 vaccine confidence and hesitancy, 23 of which were conducted in Canada. And so what we did is we classified all the factors that were being identified in these studies into the most common barriers or drivers of hesitancy and the most common enablers or drivers of confidence. So what we're finding is that when we're looking at barriers, the most commonly identified in these studies are people are worried about adverse reactions, about whether vaccines are needed, whether they work, the speed of development, whether they are safe in terms of short and long-term side effects. So there's some studies that look at whether the advice from medical professionals, close contacts, or high profile people makes a difference, and in some studies that actually hinders. Thanks. What slide back, please? Thanks. But many studies looking at this also identify mistrust in government itself and public health response as a driver of hesitancy, which we need to address. Clearly, access an issue, as well as gaps in knowledge too. These studies also identify enablers, so things like having family members or social contacts that have had COVID. A lot of research into showing that having your annual flu shot is linked to greater confidence in these vaccines. Advice from medical professionals, and importantly, having access to and trust in reputable information sources. So the question is then, we know a lot about hesitancy and confidence in these particular vaccines, and what can we do about it? Next slide. And next slide again. Thanks. So I chair the Behavioral Science Working Group in Ontario's Science Advisory Table. And within that group, we recently developed some guidance on what are some principles that we can draw from that address some of those factors we saw on the previous slide, to both address and support people in making a decision to get vaccinated, so to get at the hesitancy side. And then once they've made the decision, how can we further support them to make sure they follow through with that good confidence in the vaccine? So for example, doing things like clarifying how vaccines were able to be developed quickly and approved quickly and safely, continuing to build social norms by using social comparisons to similar other people, leveraging trusted other people to have conversations that are going to be different for different individuals, recognizing that medical mistrust is a thing and needs to be addressed and takes time to do that, and using effective risk communication tools to clarify risk and severity of getting COVID versus any vaccine side effects that people might have concerns about. But that's not enough, of course. Doing things like providing reminders, making booking and attendance as easy as possible by using accessible, convenient locations, implementing flexible work hours, paid time off, but really emphasizing one size fits all approach isn't going to work. It hasn't worked given what we're seeing about different equity seeking groups. And what we need is multiple strategies to reach those that are, for example, homebound or not as comfortable with technology. Next and final slide. So really my take home message is that vaccination continues to increase in Ontario, but not at the same rate for everyone. Clearly we need equitable access and trusted information. Those are fundamentally important, but not necessarily enough to continue to address some concerns that people might have and to continue to build vaccine confidence. And it's crucial that we continue to protect those with acute and chronic lung diseases. And that depends on both maximizing vaccine uptake for them, as well as everyone around them in the community. And finally, as vaccines rates are cresting, and we're talking about third doses for different groups, I think we need more of the same approaches to continue to work against vaccine hesitancy by doing things like matching new strategies to what we know from all this work is driving some of that remaining hesitancy. Thanks again for the opportunity to speak today.
Thank you so much. That was so informative and I think really helpful and hopeful, you know, as we were hearing more about, you know, big bad new variants and there's more confusion about what this could mean. This idea of how we can maximize vaccine uptake and address some of these issues related to changing people's behaviors and reaching them where they are at home will really make a difference. And we've seen that, you know, throughout the pandemic, Canada has done a really good job of, you know, getting people to take vaccines, but more can be done, not just for COVID-19, but also for other vaccines. You know, we're heading into the heart of flu season, and we've typically had difficulty getting a lot of people vaccinated against the flu. And so some of the strategies that are being used for COVID-19 could perhaps be rolled out for other routine vaccines as well. So there's a need here that Justin talked about, you know, to talk about a community-based approach, you know, equitable approach, not a one-size-fits-all solution to really maximize vaccine uptake and address hesitancy and concerns that people have. So things like, you know, reaching homebound seniors, expanding some of the programs such as the Homebound Sprint program that the City of Toronto had. That program, you know, set a really great example of what can be done with a little bit of innovation. and in sort of a public health emergency situation. But these kinds of things, will need more support to be rolled out elsewhere and to be rolled out to as many people as possible, so that we can help not only reach an end to this pandemic and reduce loss of life and hospitalization, but to also reduce the burden from other illnesses, from vaccine preventable diseases. That brings us to the end of this formal event, and we really appreciate your time and for being here during all of this to give us your time. And if you have any questions about any of these topics, you can reach out directly to the Lung Health Foundation. They'd be happy to set up a meeting and to talk about how some of these goals can be reached. So once again, thank all of you for being here for this Advocacy Day and for taking part, for all of the people who shared their stories and to share their thoughts. We really appreciate this, and hope to see you next time.